Hey guys, welcome back for another video in our antibiotic series. Today we'll be covering our penicillins and cephalosporins. Now, for this week, we'll finish up our antibiotics up from those main group of ones that we have been covering. So we'll also cover fluoroquinolones and our sulfonamides this week as well. We have already done our macrolides as well as our tetracyclines and the other videos that we have done to break down this antibiotic series. You can also expect some upcoming practice questions to complete to go along with these our antibiotic series as well. But I wanted to give you the material first and then start to test your knowledge on it. Okay. But as always, before we get into anything, I like to introduce myself and give my disclaimer. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nurses Studio. I do these videos for nurses and nurse practitioners to help you guys be successful on exams, boards, as well as practice, right? But my disclaimer is these videos are designed to help you in those areas. The guidelines change so much that sometimes our testing has not caught up with where we are currently because the tests have to be created and implemented to see the effectiveness of the questions. Hence the reason why on the exam we have those practice style questions. So sometimes, and most of the time, the guidelines lag a little bit on the exams, the actual boards versus what we're doing in practice. So I always like to explain when I'm covering things that we are currently doing in practice versus what are on the boards. And then you also know there's no absolutes in medicines, and we treat on a patient by patient basis. So use this material as such and follow me with the content, okay? All right, let's get into it, y'all. So with penicillins, cephalosporins, one, I always tell you guys to know the ending. So with penicillin, they're this drug class ends in "cillin," so that when you see "cillin," you'll know there is a type of penicillin. Now, you also are familiar with this. This is one of the first antibiotics created. It is a bactericidal. Remembering cytal means to kill, so it kills that bacteria, and it's also a beta lactam. It's in that beta lactam class, and I'll get more into that in a little bit. Now, cephalosporins, look at the beginning of this, the prefix of this word, because their medicines start with ceph. So you'll either see CEF or CEPH as in cephalosporins, right? This is also in the beta lactam group, and there are five generations of this. Most commonly, the 1 through 3 are the ones that are utilized, but there are five generations of the cephalosporins. I really got into this on that full video that I did of everything antibiotics, just in a short and sweet fashion. But I still want to hone in on some of these areas. Um, Again, penicillins are one of those common drug classes. Remembering, and I put penicillin and cephalosporins together on this um, video just simply because I want you to think of them together. Think of it as PC, like a computer, PC, penicillin, cephalosporins, right? Because if you want to prescribe penicillin, if they have a cephalosporin allergy, you need to hesitate and get more information before moving forward with doing that. Typically want to avoid those because typically if they have a penicillin allergy, they more than likely have a cephalosporin allergy and vice versa, right? Vice versa, right? Um, and so I group them together because I want you to think of those along those lines. Now, remembering penicillins being in that beta lactam class as well, that it mainly works towards the treatment of gram positive bacteria, but it does work with some of the gram negative ones. Beta lactams work by inhibiting that peptidoglycan synthesis, and that is those actual the outside ring of the cell walls. You remember with gram positive, they had that thin cell wall, and then with gram negative, they have a thicker one. But there is that peptidoglycan layer in both of those cell walls, and that's what beta lactam. It works by inhibiting the synthesis of that actual portion of the wall, and that's how it breaks through on those gram positive and gram negative bacteria. So, being that gram positive, that portion is thinner, that's where it's more effective with that the gram positive bacteria because we're able to kill that bacteria more effectively. And then it works on some of the gram negatives. Resistance to these medications weren't as prominent in the past, but it is increasing. And so, again, as prescribers, that's why we work to only prescribe antibiotics for bacterial diagnoses and not viruses, even when the patients, are so used to that practice from older practices, and they want to use antibiotics for more things than should, because it was like a common thing they're used to. But we just have to re-educate them on those things and treat on a patient by patient basis. Y'all know the routine, and then telling them to be sure to take the whole course of the medication as well. Making sure that they're drinking with a full glass of water. Now with penicillin, there is a drug interaction. You want to think of your DMARDs, like your methotrexate, can inhibit that absorption rate of the penicillin. And as always, y'all know with antibiotics, letting them know that this can cause GI upset, telling them what type of foods, that, it doesn't need to be anything heavy, but like crackers and things of that nature. Telling them that we do know that GI upset is something that you can have with antibiotics, but being sure to notify your provider if you're having blood in your stool with like the diarrhea, if it's excessively watery, things of this nature, because we don't want it to be an additional infection going on that is being overlooked or missed due to us thinking it's related to GI distress. So be sure to notify your provider of those things. Now, real quickly, so let me go back over the penicillin breakdown real fast, and then we'll get into those 5 generations of the cephalosporins. But remembering, penicillin ends in "-cillin", cephalosporins start with "-ceph". They are both in the beta-lactam group. Beta-lactams they work to inhibit that peptidoglycan synthesis. Work by inhibiting that. That's how they break through and penetrate that cell wall. Penicillins are more bactericidal, meaning that they work by killing the actual bacteria. Beta lactams is one of those more common classes. Penicillin is one of those first antibiotics ever created. You don't prescribe if they have an allergy to it. If they have an allergy to one, you need to consider they have it to the other when we're talking about penicillin and cephalosporins. Think PC, like a computer PC, to coordinate those together. And then into those cephalosporins. Again, there are 5 generations of those. More commonly utilized are those first 3. That first generation is typically utilized on your like skin infections, those type of things. Second is more of that upper respiratory sinusitis type infections. Third generations are utilized, say more below the belt, like your UTIs, your STIs. Those it could be with some Lyme disease if it's very very more severe cases, I should say, and some community acquired pneumonia. It's not common, but some. Okay. That fourth generation is used for more of the complicated UTIs. Also can be utilized for meningitis. Um, and some of the more complicated abdominal infections. And then lastly, we have that 5th generation with the community and hospital acquired pneumonia that fall into that group. These can be utilized sometimes as well, and also for skin infections. Okay. So you guys, that's really it for penicillin and cephalosporins. Um, I try to keep it short and sweet. You will see how things tie together when I give you the practice questions. And so you can see how to gear your mind towards this. Also, make sure as we go through these in little small increments, as you're thinking of those first line, second line therapy that we utilize in different body systems and different diagnoses, that think about these little factors that I'm telling you, because it'll help you process through it. So it might not seem like, oh, we're answering a specific question based off of this knowledge, but I'm giving you this because I know some people were saying they were having difficulty with retaining the antibiotics, and I'm just trying to give you a brief way to tie it together. So if you have specific questions that you are struggling with, feel free to put it in the comments, and I'm happy to assist you with this, even if it's a practice question that you may have gotten stuck on. I'm happy to work through those with you guys and go through those. But that's everything for today. And again, we will cover our fluoroquinolones, our sulfonamides, and then we'll start working on practice question design around these antibiotics. Okay. But as always, you guys, thank you for watching. Be sure to like, comment, subscribe, share with whomever you may think may find this beneficial as well. But make sure you meet me back here for the upcoming antibiotic series on our fluoroquinolones and our sulfonamides and hitting these practice questions, okay? And if you need me for anything and have any questions and want to work with the nursing studio, reach out to us either by phone at 803-400-6864 or shoot us a quick email at the nursingstudio1@gmail.com. Bye, y'all.